This morning, we're chatting with Principal Medical Officer of Community Services on the Ministry of Health, Dr. Priya Laloo. Good morning to you, Doctor.
Good morning, and good morning to your viewers.
How are you doing this morning?
I'm well, thank you.
Thank you so much for joining us. So we saw the advisory, hand, foot, and mouth disease. Can you firstly tell us what it is so that we have a better understanding? Because I hearing about it since I'm young, but I'm not entirely sure what it entails. What is it exactly?
So hand, foot, and mouth disease is a mild, viral, contagious disease that usually affects children.
Okay.
Particularly the ages less than 5 to 7 years of age. However, it can present in persons older and in adults as well, but less often.
And what do the symptoms look like?
But before I get into the symptoms, I would just like to say that it being a mild, contagious disease, there is no anticipation that this condition is going to become a public health threat in any way.
Okay.
The symptoms that we want to look out for, as particularly in children again, would be fever, sore throat, loss of appetite, a general feeling of being unwell, and there is a rash that develops. Usually it presents around 2 days after the fever starts in the child, and it presents on the palms of the hands, the soles of the feet, can also get it on the knees and on the elbows and on the buttocks. It looks as flat, red patches initially, but they can develop into blisters later on. Also look in the mouth of the child, where you can get sores, which can be painful.
Okay.
The rash is not an itchy rash, it tends to be painful.
And if you have any of those, it would be symptoms, or you have to have the combination of all?
You would have to have, the rash is very indicative of the disease,
Right.
and yes, one or two of the other symptoms, particularly fever and a general feeling of illness or loss of appetite in children.
Okay, and if it is we do see these symptoms, what should be the first step? Parents, for example, see it in their children, what would be the first step?
The first step would be to isolate, right? Because it is contagious, particularly with other children in the house, even with adults, to implement certain hygiene measures within the household, which is to sanitize heavily, regularly touched surfaces like countertops, toys, doorknobs, things like that, particularly for younger children with people who are changing diapers and who are caring for the infants, taking them to the bathroom for slightly older children, washing of hands. Regular washing of hands.
Okay, so would you say that is also the way to prevent it from sharing between the people who have to take care of the children and them? Is the regular washing of hands and the disinfectant?
Hygiene measures, and it can also be spread by respiratory droplets, so from sneezing, coughing.
Okay.
So persons who are infected would be advised to cover their nose, cover their mouth when they cough or sneeze.
It sounds awfully familiar.
It does, but as I said initially, and that's why I opened with that statement, that this is in no way anticipated to become a public health threat in any way. The Ministry of Health is very aware that the population is suffering from post-pandemic fatigue
And trauma.
in many ways, and we are prepared. Systems have been put into place. The surveillance systems are acute and stronger than they have ever been, as well as the primary care healthcare services have been educated, have been told that we are expecting this. This is something that we see every year in tropical countries. The statistics show that there's always an increase in the number of cases for hand, foot, and mouth disease around this time during the rainy season.
What causes the increase?
We're not quite sure epidemiologically, but we follow the temperate countries, because temperate countries, there's usually an increase at the end of summer and into early autumn, correct?
Yeah.
So then we see it in our rainy season.
So when our season changed from rainy to dry, we have the same?
There will be other things that will present more like respiratory diseases.
Okay. In terms of the surveillance system that you mentioned just now, can you describe it for us?
So the surveillance system is a system that has been in place from many, many years, even before I started in this profession. We monitor any new cases that come up. We are aware of any new cases that come up, and we also monitor the progression. So these patients will be followed for the progression of their symptoms and for any management that needs to be done, and also to be advised as to when they can interact with persons.
Okay. So if it is somebody were to see the symptoms, should they, yes, you said sanitize, make sure and isolate. Do we take them to the hospital? Do we need to go to the health center? Because how do you get the information to be able to begin having that surveillance?
Right. So usually the children, well, if they have fever, they will present to either their primary healthcare provider, if it's a private GP, or to one of our public health institutions. And once the diagnosis is made for hand, foot, and mouth, the diagnosis is picked up by our surveillance nurses, and we keep the person in view.
Okay, and how long does it last for approximately?
Symptoms will last for anywhere between 1 to 2 weeks. Usually everybody resolves within about a 10-day period.
Okay, and so we should be monitoring for that entire 10-day period.
Correct.
What sort of treatment, if any, should
There's
be
no
administered?
specific treatment for hand, foot, and mouth disease. It's supportive treatment. So for fever, paracetamol syrup for children and even adults who may present with the symptoms. Because of the painful sores that affect the mouth, difficulty swallowing is a symptom, so that you want to have soft foods for the children. You also want to give them things like ice pops, ice cream. So cold things are preferable to warm, because warm can actually aggravate the painful sores in the mouth. As well as just keep them comfortable, lots of bed rest fluids. Because of the fact that the sores in the mouth can be painful, dehydration is a concern, so that you want to kind of keep them drinking, keep them hydrated at every point in time.
Okay. Just a quick sidebar, right?
Sure.
When it comes to treating sores in children's mouth, is there any sort of medication that can treat it, or is it just the water and the...
Just the supportive measures, as we just said, which is the cold ice pops, ice chips, cold drinks. You can give them ice cream, because children will love ice cream. And it usually resolves in about a 10-day period. The paracetamol as well will also help with any pain that they're having in the mouth. So.
Okay. So it'll be a lot of monitoring, a lot of care, a lot of comfort, and a lot of cold things.
And a lot of hygiene practices.
Hygiene practices, okay.
Right? So that is the way to prevent this further spread to other members in the household, to other children. And I have to also say as well that even children in situations like in kindergartens, in childcare facilities as well, need to be aware. These facilities need to be aware of amping up their hygiene measures to ensure that a level of care is maintained and a level of hygiene is maintained in these institutions.
You mentioned earlier that adults can get it too, but it's not as often, yeah?
No, it's very rare. Adults, they tend to be asymptomatic carriers.
So they bear the problem.
Right. So if they're in contact with a child who has been diagnosed with hand, foot, and mouth, you can spread it to another child. You can spread it to another adult who may be immunocompromised. So that's why the hygiene measures are extremely important. Hand washing if you're dealing with a child that has blisters. If you're helping a child to the bathroom, if you're changing diapers, regular hand washing, regular wiping down of surfaces.
You mentioned immunocompromised adults. Would they be at risk as well?
They can be, but again, not so much in adults. Children, we tend to see this disease more in children.
More in children than anything else.
Yes.
All right. Well, we have the advice of hand washing and hygiene. We have the advice of keeping them as cool as possible. In terms of the spreading of it, is there a period in the illness where it is more contagious?
So those are uninfected tend to be most contagious in the first 2 days of starting symptoms. And the first symptoms, usually fever. So once the fever starts, usually within that 2 days before the rash, they're the most contagious.
Okay, so we should, but I mean, how soon do we, so from the time you get fever, whether we know it's hand, foot, and mouth disease or not, we should be isolated, is what you're saying? Because you're saying the fever coming before the rash and it's contagious at that point.
It's contagious at that point, but no, the advice would not be to isolate at that point in time, only when the diagnosis is actually made.
All right, fantastic. So going into the Christmas season, well, we're in the Christmas season and going towards the end of the year, are there things that we should be looking out for from a health perspective just to make sure that we are as safe as possible? Because you mentioned the schools, but schools are on vacation, so we have that benefit for now,
correct,
right?
Yes.
For this 2 weeks here. So anybody who have it, isolate home, enjoy your Christmas, and come back out to school safely. But anything else that we should be on the lookout for, should be aware of when it comes to this time period?
Well, at this time, we usually see a spike in influenza. So that
With the season change
I would
as well?
advise people to have their influenza shots.
Okay.
Right, which is readily available in all of the primary healthcare facilities.
Would the influenza shot help at all with hand, foot, and mouth
No,
disease?
it will not.
It
No,
won't at
it's a
all.
completely different virus. Hand, foot, and mouth is caused by an enterovirus, particularly and most commonly the Coxsackie 16 virus, which is different to an influenza virus.
You just said a bunch of words, and I have no idea what they mean. But I appreciate that you know what it means, and that is what really matters. All right, so the Ministry of Health is advising that we, well, firstly, get that influenza shot for the season. Be as hygienic as possible. And I don't think we need to wait on getting the disease to be more hygienic.
No, there are regular hygiene practices that we should be practicing on a day-to-day basis.
And that includes washing your hands regularly. Don't
But of
stop
course, if you
doing
have
it.
a case of hand, foot, and mouth in the house, you have to be more vigilant.
All right. Well, I want to say thank you very much, Doctor, for joining us this morning and for sharing this information. Do you care to send any greetings to Trinidad and Tobago before you leave this morning?
I would just like to wish your viewers a Merry Christmas and a very Happy New Year from the Ministry of Health. And I would again like to reiterate that hand, foot, and mouth is a mild disease. We expect to see an increase in cases around this time, so we do not anticipate that this is going to become a public health problem.
Can I ask, at what point do we determine if something is going to become a public health problem? Like, what are the criteria? Because, I mean, of course, we know what happened with COVID, right? But in terms of this, like some of the symptoms, like we mentioned, some of the ways that we're treating it in terms of the hygiene practices is very similar. So
correct.
people might be under the misconception. And I mean, I know you've said it several times, but I just want to find out, what is the differentiating factor that decides this might be a public health concern?
So how contagious the virus is? This is in no way contagious as we saw with COVID. The symptomatology and the severity of the symptomatology as well. And remember, with the COVID pandemic, it was something that was new to us. We didn't know. There were a lot of things that, we had to learn on the ground.
Yeah.
With hand, foot, and mouth, it is something that we are very aware of. We are accustomed seeing a few cases or a small rise in cases around this time. So we know how to deal with it. We expect it. As I said, the surveillance systems are acute, more so than any time else, and also the public health and the primary care services have been advised, and there are competent physicians who are able and ready to diagnose and advise about treatment.
All right, fantastic. Well, thank you so much, Dr. Laloo, for joining us this morning. To enjoy the rest of your day.
All right, thank you so much.
No problem at all. Dr. Priya Laloo, Principal Medical Officer at Community Services from the Ministry of Health, just letting us know some things that we need to be aware of when it comes to hand, foot, and mouth disease and how we can be safe. Make sure and have your precautionary measures. Please be hygienic. Wash your hands, clean up your environment, spray disinfectant, isolate, do what you need to do to make sure that you are as safe as possible during this season. We take a quick break and we come back with more on the Now Morning Show. Stick around.